For flexion of the shoulder and goniometry, the axis of rotation is the humeral head and the glenoid fossa. The steps are patient in the proper position, patient does active, go ahead and do that. Here's the active, I'm going to set it to normal. I'm going to find the humeral head and the glenoid fossa, proximal arm to the greater trochanter, distal arm to the lateral epicondyle, and then I'm going to push to get more on passive. Flip over, please. There we go. For extension, we're going to do the same thing. She's going to be lifting her arm up. Go ahead. Keep it straight. Okay, humeral head down to the greater trochanter with the proximal arm, the distal arm through the epicondyle, and then I'm going to pull her into passive. Go ahead and flip back over. For abduction of the shoulder, take your left hand and cover your right breast, please, and bring this arm, keeping it straight beside your head. This is the motion she just did, all right? Proximal arm through the ASIS, distal arm coming up through the epicondyle, finding that acromion somewhere, and there's acromion, there it is somewhere. And then I'm gonna push for passive. Always make sure the proximal arm is put back toward its landmark before you give a reading. A deduction. Duck on there. For a deduction, we're using the outer red scale, acromion. Okay, turn your head to the right. Can you bring this arm across under your chin, please, keeping it straight? I'm going to preset for normal, and I'm going to have the proximal arm away from her, distal arm through the epicondyle, and then I'll push. I want to say on this, make sure the inferior angle does not come off the table. Once it does, the move stops, okay? The inferior angle of the scapula. Internal and external rotation. Okay, just a little bit more. There we go. All right, take your palm toward the floor, keeping this 90-90 for me. Do not let her do this. Do not let your patient roll. Make sure they stop at 90-90. I'm going to preset to normal. If she's not quite there, I'll bring it back. Perpendicular to the floor for the proximal arm, distal arm through the ulnar styloid, and then I'll push for passive. And then she would do the same thing on external rotation, and then I would push for passive, using the same landmark, the olecranon. For pronation and supination of the forearm, we're using the third MCP joint as our axis. I'm going to place it on top. Make sure the proximal arm is always in the direction opposite the one you're going to use. So in this case, we want supination. Turn your palm toward your head, and you want the black line, I'm going to do this time, of the black line of the instrument to go right through the center of the third digit, just like that, if you can see. All right, and then I'm going to drive my car this way and do passive with the thumb. Don't grab the wrist, be proximal to the wrist, making sure all are in their plane. Let's go for pronation. All right, so this time the proximal arm is going away from pronation, so turn your palm in that direction. And let's set this to normal. She's not quite there, so we'll bring it here, and then we will try to get some more out of her. I'm trying, okay. For flexion of the wrist, all right. Okay, through the ulnar styloid pisiform area, and we're sighting a line through the fifth metacarpal right here. The black line of the instrument is right centered over that. Go ahead and take your hand into that position. I'm going to preset it to normal. I'm going to place it on her ulnar styloid. She's not quite there. See, this isn't it. You need to have the black line through that hypothenar. Once I'm there, then I'll push for passive. Go ahead and bring it back up. Bring it back. And for extension, same landmark. Ulnar styloid, bringing it up to through the fifth metacarpal, and then I'm going to push for passive. Turn your wrist toward your middle. We're going to do radial and ulnar deviation. Okay, radial ulnar. Now we have 30 degrees on ulnar deviation. Go ahead and take your pinky toward the table. Make sure they don't cup the hand or bend the hand. Make sure they stay in this position. I'm going to place this on the capitate, and you can see that her finger's in one direction and the instrument's going in another direction. That's because we're measuring this joint right here, not the digits. So you can see clearly that if you look on yourself, the third metacarpal goes straight up in the air, whereas the digits go off in another direction. So that's where she is right now, and then I'm gonna push for passive. Oh, I hope it rings, okay. Bring it into radial deviation. I would preset it and do passive.